I'd like to introduce Bruce Wolters, who is CEO of Hospice of St. Francis. And you are one of the partners with the Doctors Goodwill Foundation. And we were just talking about what a partnership really means. And the words that came out of your mouth a lot were education.
That's correct. The Dr. Goodwill Foundation does a lot of CME for physicians during the day, also for other healthcare professionals, but also educates the public in terms of what health needs are in the community and what can be provided by them.
Now, tell me a little bit about your organization, about the hospice. I know hospice. I have limited exposure to it, but it seems like angels to me.
Well, yeah, sometimes people say that. We're professionals that work with patients and families, and really it's an interdisciplinary team. So it's not just physicians, it's social workers, it's RN case managers, it's aides, it's chaplains, it's massage therapists who work with patients to give them a better quality of life towards the end of their life, which is a very challenging time for them and their families.
It's an emotional time too, and that's one of the aspects. But it's emotional for the people who do the work too, isn't it?
Yes, it is. Sometimes they have to step back for a little bit and take a break, and we have opportunities for them to do that. And they also can work with our staff, with our counselors, to understand what their emotions are. We got to remain professional. We want to be empathetic. We want to be sympathetic. We want to work with the families, but you can't become overly involved because you're still a professional.
Sure.
We're providing the professional services.
When you try to educate people about hospice, what do you find we are confused about or don't have enough information about?
I think sometimes people think that it's just for patients with cancer, but it's for all terminal diagnoses. We have a very good opportunity. We worked with the Doctors Goodwill Foundation. We've always been providing education to physicians in the community to try to get them to go, patients, for them to identify patients in an appropriate time frame, not the last 3 days of life, but towards the end of life, because the hospice Medicare benefit goes up to 6 months.
Do you find that sometimes people think that hospice is only for the rich?
No, I think it's grown beyond that, but I think it's part of the continuum of care now, and people believe that it's there and they're using it appropriately.